I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah. Get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body and the blade.
Welcome back to Beauty and the Blade. We're super excited to have you back. We've got a very special guest today. And I am Dr. Edward Park.
And I am Ashlee Park. Hey guys.
My angel wife.
So we have our fabulous patient care coordinator. She holds a very special place in my heart. She has been with us for over 7 years. And not only do I work with her, but she's a friend of mine. So it makes work very easy.
And a special friend of mine too, if I may say so. We're family.
Hi, friend.
We are. Hi, guys.
Before we get into this,
Oh, you want to do a myth buster?
we should probably do a myth
Are you
buster.
guys ready for this one?
Let's do
So
it.
I'm going to ask it, and you guys tell me what you think.
Okay, and
Okay.
we'll even let Franny get involved here.
Yeah.
All right.
Let's go.
So, Mythbuster. Breast implants will increase your risk of breast cancer.
What do you think?
I
Franny?
think it's false.
I agree wholeheartedly. As a matter of fact, it's quite the opposite. I will say that for breast cancer reconstruction, my number one go-to is to reconstruct with implants. So the process of that is I integrate after a mastectomy for breast cancer. I will work concurrently with the general surgeon and put an implant in immediately to help reconstruct. I think that's very important in this day and age because we used to do a delayed mastectomy and women would have absent breasts for many months, and that's very depressing. So I put in an implant immediately with the mastectomy.
Yes. Okay, so that was false news.
False news.
Okay, so let's go back into Frances, our patient care coordinator.
Hi,
So
Franny.
if all of you guys, if you don't know, so a patient care coordinator, this is somebody that you're going to, if you call and you have any questions about a surgery or procedure that we do, you will be talking to one of our patient care coordinators. And Fran is actually one of 3 that we have, right?
Correct.
And also, she's going to be with you to hold your hand from the beginning to
the
it's
end.
never the end.
It's never.
It's never the end. So tell us a little bit about yourself, of what you do at our practice.
Your role.
Well, I do all the consults with Dr. Park and kind of show patients how to choose implant sizes if that's what they're coming in for, or if they have any questions or want to know information on what comes after surgery or during or recovery time, all of that. And then even after, like, I can see you for suture removals or post-op care or weekend calls in the middle of the night, which is fine too. Text messages, I'm always available.
So a little bit of everything.
Yeah,
I
you
would
do
say.
everything.
Yeah. I love it though.
I mean, I literally would say in my clinic, Frances is my right hand. I mean, she literally can and does everything. She's kind of an extension of me. But even more than that is the preparation, I think, that you do for the patients. I think, walk us through a little bit about, let's say a patient calls for a consult, and take us through the steps of, I guess, what the patient will go through.
Normally when they call, we kind of go over like what procedure they're interested in, time frame. Most patients want to know costs, so we go over that. And kind of go into details. A lot of the times if it's like a mommy makeover, luckily I've experienced it, thanks to you. So I get to kind of explain in my own, how it went for me and recovery and everything. So we kind of get a better connection in that sense. And then we kind of go from there. But
what if we had a patient that, I know during when we were going through COVID, we're still going through it, but in the beginning, we weren't seeing patients on site at first and we're doing virtual. Are you guys still doing virtual appointments for, say, somebody that's coming from out of state or they're working during our business hours?
We definitely accommodate for everyone. So, I mean, we do have a lot of out-of-state patients now, which is totally fine. We can do everything all up until the pre-op. We do like patients to come in for pre-op so we can, do an in-person exam with Dr. Park so he can kind of really get to know the patient and understand and show expectations, and they get to meet us in person. You know, it makes it a little more personable.
If a person that was coming from out of state and they were looking at having a procedure, would they say they wanted to make it a one, long trip? Would you be able to have their pre-op the week or two before, and they're just here?
Yeah,
during that time?
definitely. We can do labs. I mean, we can put them in a stat labs. It just depends on patient's health. I mean, as long as they're, relatively healthy, we run their labs. And then we can do pre-op, consultation. We can do all of it within 14 days.
Okay.
You know what I mean?
That's good to know, because there's a lot of patients that come from all over. I know you guys get these, but a lot of times people don't know how, I feel like I suffer from anxiety, so I'm like, I'm going to do this. How am I going to, So it's good that you guys are able to do that.
Yeah, and they can contact us constantly. So it's not like we just do the consultation via FaceTime or whatever, and they can't ask questions. They can call us, email us, Dr. Park's email, my email. I mean, we're always available.
So let's walk through the steps here, because I really want the patients out here to understand the exact process. So they made the phone call with you. You've gone through all the basic information. You've scheduled the consultation. Patient's real nervous. They walk through the door. Walk us through a consultation with you and I.
Well, normally everyone's nervous. I mean, you
Yeah.
walk into a plastic surgery office and everyone is beautiful and perfect, and that's what you expect, and you're coming in for definitely you, Dr. Park, you're the perfect one. I mean, you think like you're coming in, as a patient myself, like you walk in and it's very nerve-wracking coming in to
Right.
tell someone like, I don't like this
Right.
about myself. So in order to be comfortable enough to go through the whole process, you have to understand and connect with the person you're speaking with. And the main thing I hear about you is you really listen to patients and you understand them and you take time with them. And a lot of our patients, even if, our price is higher or, they have to wait a little longer for surgery because we're booked up, they always choose you because of the way you are with them and the way you actually care.
But I'm going to actually say they always choose us. As you say that I listen, I really feel you, Yancy, and Lizette, our three coordinators, and the entire staff, listen tremendously.
Yeah.
I can't stress that enough. I don't even know half the back work that you guys are talking with the patients, even before I meet the patient, So I think even right at the consultation, you're basically getting them comfortable, so that, big Dr. Park coming in, and I'm actually not that big, but I think we're stressing that you make them feel so incredibly comfortable, our entire staff.
Yeah, well, it's nice to walk into an environment where they're real people. Like, we've all gone through something. We've all had something done. We've all wanted to better ourselves in some way, physical, mental, whatever.
Right.
And, it's nice that everyone in our office is willing to share their experience.
Right.
Yeah.
And their results.
Yeah, it's my favorite.
I really love that you relate with them, you bring them into the room, and if it's a mommy makeover, you've done it, so you're very relatable.
Best thing ever, by the way.
How nervous do you think they are after do you have the ability to calm them down?
100%. Only because, when you're in this industry, I'm not uncomfortable with showing results and being there and telling them every little detail about my personal life, which I don't mind, they're coming in and they're expressing their worst fear of, I'm uncomfortable with this. I've had children. I was made fun of or criticized for something specific. And it's everyone has that. And if you're willing to share it with them, you really build a connection and it means something,
Right. So they've gone through their consultation. Now they're booking their surgery. So how far is it from the consultation to, you said the next appointment would be their pre-op. So does that just depend on surgery date?
Availability. With our OR, holiday season, we're very busy. We're very, backlogged. I've had patients try to bribe me to come in sooner with Dr. Park.
Yeah.
So, it's more of just trying to accommodate their time frame and what surgery they're having based on what their recovery time is and whatnot. But I always find a way to make it happen,
You do.
even if the OR is mad at me.
You're the
I
miracle
do.
worker.
I do.
Talk a little bit about, again, physically, we've done our consultation in the room. Then I find that you escort them back to your coordinator office room. What goes on in that part right there?
The real talk.
The real talk.
The real talk. Just all the
little bit of-
nitty gritty,
You're
all
just
this
very
stuff.
personable.
Yes.
You relate to the patient, and you
Yeah.
are very calming, and
Right.
you've been through procedures, so you can discuss that with
Yeah.
them.
And, I always want to be brutally honest with people. I don't want to give them a facade of what they think is going to happen.
Right.
This is going to be the perfect scenario. Like,
Right.
there is, the best part is once you're over the hump of surgery, but there is some speed bumps on the way. You
Right.
know what I mean? And I'm never dishonest about that. I always tell them, like, it's not the easiest thing in the world, but,
Right.
And what in life is that's worth
Right.
doing,
Right. Talk a little bit about, so you're in the consult room or your office. What type of, you talk about financials, of course.
Yeah.
Tell us a little bit, options.
We have so many options for financing. I mean, you can use any major credit card. You can use Care Credit. It has 18 months, no interest. We also have, they have up to 84 months of financing. I've seen payments as low as like $106 for a full mommy makeover.
Wow.
And then
I can
I've
afford
seen, it's great. It's a great option, especially if you're struggling and this is,
Right.
like you want this so bad. And if it's money that's in the way, like I'm going to find a way to help you.
Right. Oh, you're so sweet.
Yeah. I like happiness.
What if one has a partner or spouse that's against them having it? That's got to be tough.
It's not about the spouse though. It's about them.
I know, but it does
Yeah,
play a
it
huge
does.
role, and it's hard for them. How do you discuss that with them?
It's more about finding a balance in what is more important. If it's something like, I've seen women come in with their husbands and their husbands are like, oh no, go bigger
Yeah.
for
Oh, yeah.
breast implants. And at that point, when I get them alone, I'm like, it's your body, like it's your choice. You know what I mean? If you want to not do implants and just do a lift, or if you want to go, Pamela Anderson, like it's
Right.
your choice.
Right.
Like it's, at the end of the day, if your partner loves you, he's going to accept it.
Right.
That's
It
true.
doesn't matter what you look like on
true.
the outside. He loves you for a reason. It's, him or her.
Yeah.
It's really your own choice.
Right.
Yeah. And they just need to accept it and be okay with it.
Right.
So they've done the coordinating. Let's say they've selected the surgery date. You're doing also, what type of appointments are they expected to receive with
So
their surgery?
consult, they'll book at consult and then they'll come in for pre-op. Depending on surgery day is within, if I can sneak them in a few days without getting in trouble.
1 to 2 weeks.
Well, yeah,
average.
depending. Sometimes we add surgery days.
Right.
But depending on when their surgery is, it would be a pre-op. They come in and then they meet with you at another pre-op day of surgery. Then you do your marking and you go over everything all over again. And then a lot of the times, we have to re-explain, implant sizing. When you do the markings, they have a lot of questions. And then after that, we see them for the 1-day post-op, which is really quick and easy. They come in, we get them in and out. Then we see them again, depending on surgery, 6 to 10 days post-op for suture removal.
Okay.
Then after that, we see them at 4 months or 4 weeks to release them for exercise, depending on the surgery, 4 to 6 weeks if it's a tummy. And then we see them again 3 months, 6 months, 9 months if, they want to come in again.
Right.
And then annually.
Yeah. So up to a year, quite
Yeah.
a number of appointments.
Yeah.
And whenever they want to visit.
Yeah.
And they do. They pop in all the time. I
Open
love
heart
it.
policy.
You guys
We have
get
lots
a
of
lot
visitors.
of returning
Yes,
patients.
we do.
Right.
We're like a
Yeah.
family.
Right.
Yeah.
We really are.
Yeah.
Tell us a little bit about, again, they're pretty nervous up to surgery. What type of calls? Well, let me say one thing I'm back up is that Frances gives her personal work cell phone. And I don't even want to know how many texts she gets because I mean,
No,
literally.
I've been with her outside of work, and I'm like, I mean,
Constant.
I'm part owner of this practice, and I'm even like, okay, girl, put your phone down.
Yeah. But I just want to stress how important that communication is. She is literally your lifeline, and she answers, again, literally every single question. And if it needs to extend to me, of course, I'm available. But I mean, gosh, how many questions and what type of questions do you kind of handhold them through?
You know, a lot of it's prior, like right before surgery, you know,
Yeah.
like a few days right before surgery, they kind of
Right.
panic, which is normal. And I get it because I was that panic. I called you before my surgery. I mean, come on, you know. And then it's usually like that first week where it's kind of the roller coaster where they're like, oh my God, is this normal? Like, what is this? Why
Right.
is this swollen? Is this supposed to be, is this red or is this, you know,
Yeah.
and that's okay because they're scared, you know?
Right.
Yeah.
It's a whole
and
new
you don't
thing.
know what to expect. It's,
Yeah,
you know.
you can read it all day long, but like when it's
Right.
on your body, you're like, oh my gosh, what is this? Or
And I feel that that's something that you do. Like, you explain things to patients. Like, you break it down to them, to whereas like us, we're like, well, this is what's going to happen, and this is,
Yeah.
you know.
Very
And-
methodical.
Yeah, but you really break it down for them, and you're very calm with doing it and explaining everything.
I'll add to that. I mean, I think there's an element of you just have this gift of an emotional connection and emotional support. We don't often talk about all the emotional highs and lows after surgery, but Frances is literally supporting, you know, these patients just incredible with just
Right.
love and compassion.
Yeah.
I mean, really, really good at that. I'm going to call you a lot when I have my surgery, if I ever have surgery.
I can't wait.
Oh, I'm waiting for this.
I'm just waiting for the Botox. I'm being there, that's for sure.
Yeah, and no numbing cream.
No numbing cream for you. Nope, here's an implant.
Oh my goodness.
Yeah.
So I want to talk a little bit about what is kind of a core value that we try to pretend to our patients.
I mean, we always want to do concierge service. I mean, just being there, I think that's what separates us from a lot of other practices is, you know, if one person isn't available, someone will always be there. You know,
Right.
if it's not, you know, like if I'm out of town, Yancey or Lizette will take over. If Yancey's out of town, me or Lizette or vice, you know what I mean? The three of us are a great team. And then if all of us are, who knows, on a cruise, maybe.
Sounds good.
You know, I
I'll
don't know.
be
There
there.
is someone in the office that
Right.
will always,
Yeah.
you know, be there to answer your questions, hold your hand. I mean, we have Maria, and she's a
Wonderful
phenomenal nurse, and she's so knowledgeable. And I mean, I've learned so much from her. And
Yeah.
you know, we're just such a good team, and we have
Right.
such a good. It's a family, you know.
Yeah.
I agree.
It's like my home.
Yeah, it really is.
Yeah.
And the patients become kind of our
Yeah.
family too.
Yeah.
And I think, again, just stressing that warmth and that compassion.
100%.
Really that you know, Frances has, that Yancey.
Yeah.
You guys are just really, really
Yeah.
good at it.
It's because we
I'm
love
okay
our
at
jobs.
it.
We kind of got a good boss, I guess.
But you
Thanks,
guys
Ashley. Just kidding.
Even, like, even being out in public outside of work, I see the way that you are. You're so compassionate with the individual and so admiring.
But going into, so let's talk about a little bit of humor. I mean, Fran is a pretty funny character.
She is
Her-
so funny. I really feel that because my husband thinks he's very funny. Okay, he is very funny. But I'm going to get
funny.
you guys on stage one time.
We're gonna do some
Yes, because you guys would be hilarious.
comedy act.
Oh my God, the button thing. Remember?
Yeah.
Okay, tell us that story. This is really
Perfect
funny.
story about Dr. Park. So it's like right after COVID, we kind of like snuck our patients back in. We were all family again,
Yeah.
you know, living our best life. Everyone had the COVID-15, right? So we're sitting there, and Dr. Park's in his like too small of jacket. No
I was
offense.
working
You didn't have
out.
Ozempic yet, okay? It's fine. You know, whatever. No judgment. And we're sitting there talking to a patient, and he's completely just solid face, just serious face. Yeah, his doctor face is on,
Yeah.
right? Talking to a patient, and he like moves a little, and his button flies off his shirt and hits our poor patient. And literally, we all just stared at each other for like 3 minutes. No one said anything.
I would like to think that was my chest.
It was your. We're not.
It was somebody.
It doesn't matter. A button's a button. Doesn't matter
That
where it
is
came from. It
hilarious.
was the funniest. I haven't laughed so hard. I was crying. Like it was. It was a good one. And I think that's when we started our fitness challenge.
Yes, I do remember that. Yes.
Yeah. It was probably one of the best days I've had there. That was perfect. And now I get to hold it against you forever.
But the point is, I think, we love to laugh.
Yes.
And we I truly believe laughter is the best medicine. And I think some patients will see us in consultations and we're kind of joking around, kind of like brother and sister. And we just have such a good time and try to really, the levity in our relationship is just a lot of fun.
It's very important to love what you do and love your job, love the people that you're around, because you're with each other all the time.
All day.
All the time.
More than your family.
Yeah.
You guys are my family, though. Seriously, I put you down for my son's call, like if something
Emergency.
happens. Not you, Ashley, because she'll answer.
I'm in surgery.
I know.
It's a little bit
So
tough.
I want to get into a listener email.
All
You
right.
guys ready?
Ready.
This email says, "Hi, this is Lisa calling from Tarzana. I love listening to your show and I have a question about scar revision. Last year, I had a pretty bad accident that left me with some noticeable scars on my face. I've been considering scar revision surgery, but I'm not sure what it entails and if it's the right option for me. Can you provide me with some information about scar revision procedures and their effectiveness and the potential risks involved? Thank you so much." Well, we want to say thank you, Lisa, for emailing in. What would you say for that?
Yeah, Francis.
So
Lead
as a
us in.
coordinator, say it was a call that came in or an email.
Right.
I would contact her and just kind of get details on how long ago the scar, happened.
Right.
If she's seen like a dermatologist for the area, if there's any skin pigment, everything. Get all the information and then kind of have her send in photos if she's out of the area. And it really depends on like around the mouth is hard because it's a movement area.
Right.
I mean, cheeks are pretty easy. I've seen them do flawless, mole removals and things like that on the face.
Right.
Even under eyes where he had to go way low. I mean, the face is very vascular, so it heals quickly.
Exactly.
Scars kind of fade. I mean, if she's younger, then she has a good chance it could fade on its own, just depending on the severity. But I mean, scar revisions are pretty seamless. I mean, it's a local procedure. It's in and out. I mean, she wouldn't even need a driver.
Oh, nice.
So it's
Thank
pretty
you,
easy.
Dr. Fran.
You're welcome.
She covered literally about 90% of it, and that's how good she is. The only things I would add is generally I will wait approximately a year at least to let all the collagen remodeling happen for a scar revision. And then after that, we just look and see, I'll assess to see if, there is even a possibility to improve the scar. A lot of the times, like you said, the scar fades so incredibly well, especially in children, where we won't even have to do a scar revision. So children heal extremely well. Your point, the face is very vascular and heals great. And so, if it's not a very wide, malicious scar, then a lot of the times we don't even have to do a scar revision.
Yeah.
Right.
But I would wait a full year.
Yeah.
So, Fran, we sometimes play these little games, or it's just like a little get to know you a little bit better, right? So, did anything funny happen to you that really stood out that happened to you this week?
Something funny happens to her all the time.
I'm all this
Every
week.
Monday, there's something funny.
Every Monday.
Where do I start? What day is it? I mean, nothing, I guess, specifically.
Right?
I don't,
pretty funny.
it's been a little calm in my front,
Well,
actually.
that's good.
I don't know.
That's really good.
Surprisingly.
How about this? So I remember years ago when I first started my first job in plastic surgery, I would get these okay, we all know in school we always learn no question is a dumb question, right? But this was pretty funny. So I think I was 2 weeks into my job. So did I know about plastic surgery? Absolutely not. I don't even know how, or I couldn't, I don't even know why they were having me answer the
You
phone.
were fake it till you make it.
Yeah, fake
I
it
like
till
it.
you make it. So I had this patient call in and she says, "Oh, I just had my breast augmentation and I'm going to go in the jacuzzi with some friends. Are my breast implants going to boil?" And I remember, I
Wow.
thought, okay, is this a prank call? And I just started laughing. But I was like, okay, I know nothing about plastic surgery at that time. And I just started laughing. I was like, are you serious?
Well, that's an interesting.
I mean-
because I would ask if they were saline. I mean, they could potentially.
Really?
Maybe rupture, maybe it
No.
could break down like the material, you know, because it's water and
Probably
you know.
not.
But
I don't think
I mean,
so.
no one would get into a jacuzzi that's that hot for it to boil
Yeah.
to the
Right,
point where
right.
it,
Because your body temperature.
you're right.
is
You
already-
can't. Your
yeah.
body wouldn't.
But in all
Take it.
seriousness, yeah, your tissue is covering. What I have heard though is once in a blue moon, some patient will say, "Hey, my implants feel cold in cold weather."
Really?
Oh,
they
I've heard that
yeah,
too.
that's
I
a-
have heard that.
But again,
Wow.
nothing to be worrisome about.
So that's how I'm going to get out of going skiing.
Yeah, oh.
I'm so sorry, honey. I can't
hate
go.
skiing.
My implants feel
She
so
does.
cold.
There we go. I like it. We'll go to Vegas.
So
So are there any questions that anybody has ever asked you that you can remember? Or
A lot of patients normally just ask about like saline versus silicone. A lot of the times we try to push patients away from saline because I mean the new 5th generation gummy bear silicone
a lot
implants
better.
are phenomenal. I mean,
Right.
I've never seen a rupture in 7 years that I've been working with you
Right.
guys. So, but I have had a deflation on my own. Remember?
saline, yeah.
but you had saline at
I
that
had saline,
point.
yeah. So I never had any issues until then.
Yeah.
But I mean, other than that, I get the typical questions like I moved funny, I'm having a zinging pain, or is this, you know, does the scar incision look normal? Like, you know,
Right.
the typical questions.
Yeah.
Nothing really like boiling my implants crazy.
So if you do have questions, we're actually going to wrap it up. The time went so incredibly quickly. But please call us at 1-888-900-9065. Again, 1-888-900-9065. And if you have information, look up the website at faceandbody.com, faceletterndbody.com, and or our IG. Follow us at Face and Body Plastic Surgery.
Yes. Thank you, Francis, so much for being
Thanks,
on and
Franny.
giving us
Thanks,
all
guys,
your
for having me.
intel, and we love you.
I love you guys too.
Love ya.
So thank you all for tuning in and listening to us on Go Country 105. We will be here every Sunday morning at 7:30. Beauty in the Blade, where beauty begins.
Oh, I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blend. Yeah, get it right with the knife who slays. Beauty and the blend. Get it right with the knife who slays. Face and body.